Welcome to Healthline 3. I'm Terry Simmons. Today we're talking with Dr. Jagan Beedupalli with Willis Knighton Cardiology. We're talking about heart and vascular disease, and we'll be taking your calls throughout the show. And as a reminder, please make sure you're in a quiet room with your TV turned down all the way so we can hear your questions really loud and clear. The number to call is 318-219-4569, and a little bit later you'll see that across the bottom of your screen throughout the show. Thank you so much for being here.
All right, thanks, Terry. Thanks for having me. It's my pleasure.
Oh, it's our pleasure, and I'm really glad that we had this whole half hour to really talk about this and be open to calls from our viewers. And so let's just start again in case someone wasn't watching earlier. Let's talk about this condition that you're telling us about.
So this condition is called atherosclerosis. It's very common. It's in fact the number one killer of the people in the United States. Cancer maybe a little above or below this. In fact, I think cancer is probably number 2, but atherosclerosis is definitely up there, causing lots of health problems and killing Americans a lot. And this process, to put in simple terms, is deposition of excess fat in the arteries of the body. Arteries are the blood vessels that come from the heart, supply blood to different vital organs in the body, like the brain, heart itself, the legs, the intestines, GI tract, liver, spleen, all the vital organs. So this excess fat can deposit in any of these arteries, and what happens is, sometimes there's a lot of fat depositing in there. It can encroach onto the lumen of the blood vessels, decreasing the blood flow and sometimes acutely cutting off the blood supply to these vital organs. So depending on how bad this blockage gets, so for example, say in the heart, you have some blockage that decreases blood flow to part of the heart muscle, then you start having chest pains, especially when you're putting your heart to work, like when you're doing your day-to-day daily activities or walking or doing some kind of stuff. Then your heart rate goes up, and then the blood supply that it's getting through the blocked artery is not enough, and you start having chest pains. That's what we call angina. This is in the early stages, but what can happen is eventually the lining of the blood vessels on top of this blockage can rupture. Once that happens, it attracts a clot and then acutely cutting off the blood flow to that part of the heart muscle, and then it can suffer a heart attack. That's when you have like severe pain in the chest, and then at that time the artery is completely blocked off with a clot, and then if you don't take him to the hospital and get that artery opened up in time, it can suffer significant damage, and that part of the heart muscle might die, and they might, that can be life-threatening for sure. And even if they make it out of it, they'll have consequences with low heart function. That's an entire different medical condition, and they don't do well with that. And say the same thing happens with arteries that go to the brain, it can cause major strokes that can be life-threatening. And if it happens to the arteries that supply the legs, the initial phases, we call it claudication, where if the patient walks a certain distance, their legs get heavy because the blood supply it's needing for that much of exercise is not enough through the blocked artery, and then the muscles get heavy, and then you got to sit down at the time, and then after that it gets a little better, and then they get up and start walking again. But at the same time, the same thing where you form a clot around the blockage in those arteries that can acutely cut the blood supply to those legs, and then we call it acute limb ischemia, which is basically a cold, pulseless leg, and that's a life-threatening emergency, or at least a limb-threatening emergency, where you may even end up losing the leg if you don't take care of it, taking it to the hospital and getting the blood flow restored. So there are like really life-threatening consequences if you don't take care of it. And then we'll be talking about all the risk factors and stuff like that, how to treat it and all that. But just to give an idea about what this atherosclerosis is, I made a short video. Let's play that video and see if we can, get it to the viewers.
Okay.
The heart pumps blood to the body through a complex network of arteries. With the exception of the coronary arteries, which nourish the heart itself, most arteries transport oxygen-rich blood away from the heart. Circulating in the blood are red blood cells, white blood cells, nutrients, and other life-sustaining substances. Cholesterol and other fatty substances also circulate in the blood. Over time, these substances can be deposited in the artery walls, a condition called atherosclerosis. The deposited cholesterol, or plaque, can build up over time, causing hardening and narrowing of the otherwise smooth artery walls. When the walls of the artery become narrowed and hardened, blood flow is restricted. As the plaque accumulates, the buildup can become unstable and may break off or rupture. A condition called thrombosis results when blood starts to coagulate or clump together at the site of the rupture, similar to the way blood clots to stop bleeding from a cut. The blockage or thrombus can grow larger, further restricting the flow of blood. The thrombus is also in danger of breaking from the site and traveling through the arteries. The blockage caused by a thrombus can be life-threatening. A blockage in the coronary arteries may cause a heart attack, while blockage in a cerebral artery may cause a stroke. Blockage in one of the major arteries of the body can prevent blood flow to an extremity or organ, causing pain and tissue damage to the area.
Right, I think that kind of sums up a little bit,
Yes, I love
to
having a
understand.
visual like that where I can
Right.
see it's exactly the way you described it. But when you really see what's going on in the arteries like that, it's pretty alarming, especially when you say it's a #1 killer, that maybe
Exactly.
cancer could be second to that.
Right.
Interesting.
They're kind of competing because
Yeah.
it used to be #1, and again, the cancer kind of took over because we had a lot of good treatments for atherosclerosis and the prevention and all that, but I think, they're neck to neck.
Yeah. So what are the treatments for it?
So the treatments for these, basically, you can treat with, there are some medications like aspirin, which can prevent the rupture and clotting of blood in those blockages, but definitely aspirin is not for everybody because, it also has some risk of bleeding. So it's over the counter, so just don't go buy the aspirin just because you're afraid of having a heart attack or a stroke because it can cause bleeding. So it's definitely consult your doctor before you start taking an aspirin, and we need to justify the risk of taking an aspirin. It all depends on your risk factors for coronary artery disease or other kind of atherosclerotic disease. If it's the risk is substantial, then the risk of bleeding with aspirin is justified and you may be a candidate to take an aspirin. So aspirin is one, and definitely cholesterol lowering medications, especially statins, because high cholesterol levels in the body can cause deposition of these atherosclerotic plaques in the blood vessels, causing narrowing of these arteries. So definitely controlling these cholesterol levels definitely helps, and the statins are the ones that can control the cholesterol levels. On top of that, it decreases the inflammation in the body, and inflammation has been proven to have a role in causing heart attacks and strokes. So statins work in different ways. When I say statins, they are like atorvastatin, rosuvastatin. There's so many other medications that can lower the cholesterol. These are the ones, and definitely lifestyle modifications play a huge role. Like, don't smoke, exercise regularly, have at least 40 minutes a day, 4 days a week of moderate intensity exercise, have time for exercise, definitely, no matter how busy your lifestyle is. And then eat right, low carb, moderate fat, and high protein diet is the way to go. As I said, definitely don't smoke and minimize alcohol consumption. And these are the things that can stabilize these blockages. And in some cases, if you follow like very strict vegan diet with regular exercise, it has shown to even decrease the amount of blockage a little bit, but for the most part, they're there to stay. But if the blockage is getting too much and then causing blood flow issues to the organs in your body, then we can do what you call stents. Though that's a metal scaffolding that you put in there, kind of push the blockage away. It's not going to take it out, but it's just going to push the blockage away so that it'll make way for the blood flow to that organ without any obstruction. So that you can do that in people who are quite symptomatic with these blockages. And in other instances, when you do it is when somebody has like a heart attack or a ruptured plaque with a clot, then you definitely have to go in and reopen that artery and then put in a stent at that time. So these are some mechanical treatments and also medical treatments that you do.
And definitely ways to prevent things.
Right,
and,
absolutely.
which
Prevention is
probably the best
always
way.
the better than cure.
Yeah.
Right.
And so we do talk about smoking. I'm always, I shouldn't be, but I'm alarmed at how many how many doctors, professionals, health professionals come through here, and it's always, even if you did nothing else but stop smoking. Smoking leads to so much.
So much.
Yeah.
Absolutely, yeah. Like, our practice, if there is no smoking in the world, probably our practice would have been like way down. You wouldn't be seeing as many patients as we're seeing right now, probably very, very little.
Really?
So yeah, smoking plays a huge role in all this pathophysiology of all these diseases. It's terrible.
Yeah.
And they develop aneurysms and blockages here and there, strokes, heart attacks, cancers. Yeah.
It's really
the list
remarkable.
goes on and on. Yeah.
It does go on, and it's really interesting because all we ever think of, or most people, and what we've always heard about, it's more about the lungs, and we don't think about, really realize that it really adds to so many other things in your body.
So even bladder cancer is caused by smoking, which
Really?
is like way, completely detached from, any of this.
Well, what is it about smoking that causes?
Smoking is known to have a lot of carcinogens, and then it goes into the blood, and then it just affects multiple organs. Lungs definitely are the direct, thing that can be affected. Yeah, but once these carcinogens get into the bloodstream, it can affect multiple organs, like bladder cancer and so many other different cancers that you get from smoking.
Yeah.
And then it's very hard to quit, and I've seen, I talk to patients, quit smoking even after they have like a lung cancer, or they're in a very debilitated state, they had aneurysms and strokes, heart attacks, and it's so hard. It's only a handful of people will quit, and majority of them, it's very hard. So once you get into the habit, you have to have really strong willpower, and you have to be really going at it to quit.
Yeah, I really do, and it really is a difficult thing, and so it's really to be kind to yourself too, not shame yourself or blame yourself if you're trying to quit and you can't. It really is something to be kind to yourself. And I read the word, even cutting back, at least. Like, don't make yourself quit right away. If you just, does it improve right away if you cut back?
I would say cutting back never works, because they always find reasons to get back to what they were smoking before.
Yes.
Because they'll have some stress in their life, if not now, maybe 2-3 months down the lane, and they're back smoking like 1 or 2 packs a day.
Right.
So I usually tell people, quit smoking cold turkey. That's the way to go. Tell all your friends and family that you're going to be quitting smoking on certain day. You say, okay, my birthday or your spouse's birthday. You say, okay, I'm going to quit smoking. Tell everybody that you're not going to do it, and then just quit cold turkey.
Yeah.
And you can use some supplements like nicotine gum patch just temporarily to get over those urges, but cutting down really doesn't really work.
No.
I've never seen anybody quit smoking by cutting down.
Okay.
So it has to be cold turkey.
Okay, we're going to get back to that in a minute. You have a caller who'd like to speak to you.
Sure.
Nisha, what is your question for the doctor? Nisha, are you there?
I have a question. Yes, I'm here.
Okay.
Yeah, hi, Isha.
Yeah. Yes. I had a question about, I have a lot of family members in my family that they have bad heart problems.
Okay.
And the people in my family, they usually, on my dad's side, they usually don't live long. Like, they die early. And it's usually because of a heart problem.
Okay.
And they smoke a lot of cigarettes, but I don't smoke cigarettes, but I always have anxiety of
That's a very good question. Actually, yes, just because of family. Okay. I was about to bring the topic up, because definitely family history plays a role in this heart disease, heart attacks and strokes and whatnot, all these things. But if you control other risk factors, like don't smoke, exercise regularly, cut down on the carbs, and maintain a healthy lifestyle. I've seen so many people that they had a very strong family history, but if they do all the other things right, they never ever had any issues with heart attacks or strokes. I know a lot of them. I never seen anybody who maintained a strict lifestyle who had a bad outcome though they had like bad family history. So your family history, you don't have to be concerned about that. Just don't be anxious. Don't lose hope on that, because family history is just a part of it. And the reason why your family members had all those things were probably they were smoking. That contributes a lot. And even if you have significant family history, if you don't smoke, eat right, have time for exercise, as I said, at least 40 minutes a day, 4 days a week of exercise, you will do good and you will not have any bad outcomes. Does it answer your question?
Thank you so much. It really helped a lot.
All right.
Yes, it does. Thank you. I really appreciate that.
You're welcome, ma'am.
Thank you so much for calling. I think that's a really important point.
That is an important
yeah,
point,
I'd like
yes,
to talk about that more
absolutely,
too, but we have another caller for you.
Okay.
We have AJ on the line. Hi, AJ. What is your question?
Why do my nipples get hard every time I take a shower?
That probably doesn't have anything to do with
Yeah, I
our
don't
topic
think
today.
so.
I think
Yeah.
you could ask your own doctor that. But thank you so much for calling.
All right.
So I think it's good to talk about because it's a really good thing to think about when we hear that we have a family history of something.
Right.
That doesn't mean you're definitely going to get that. It just
No,
means it's
not.
something to watch for. You
Definitely
could be
watch for
prone,
it.
or just something to alert.
Majority of the time when they have bad family history, they tend to have familiar hypercholesterolemia. I mean, the high cholesterol runs in the family. They have really high cholesterol levels. I've seen that a lot. And now we have like very advanced medications, which we call PCSK9 inhibitors, Repatha, those things that you usually see ads on TV also. So these medications and statins can cut these cholesterol levels down significantly. And that's what I said. Even if you have family history, you control your diabetes well, you control your cholesterol well, and regular exercise and good dietary habits and no smoking, all these things, you will not be affected by these things very much. You wouldn't have any bad outcomes.
You could be the
That's
one
my
in your family to
experience.
change that.
Right.
Yeah.
Mhm.
Okay. We have a James on the line for you.
Right.
James, what is your question for the doctor? Are you there, James?
James?
No?
Yes, I'm here. I had a question for the doctor.
Okay.
Yes, I want to know, how about the marijuana, though? How about you don't smoke the tobacco when you put in your cigar, you're smoking a cigar leaf, and they're putting marijuana in and find out if you cancer too?
Yeah, I can't hear
Can
you
you
properly, sir.
Yeah, I'm
What-
sorry, James, we can't understand you very much. We can't hear your
Eddie, your
question.
voice is breaking up.
Yeah.
I don't know if you're on speaker or something.
Okay, can you understand me now? Hello?
Yeah, it's better.
Okay. Oh, yes, this is my question was, if you smoke marijuana in a tobacco product, but you ain't smoking tobacco, you put in a tobacco leaf, like a cigar.
Uh-huh.
Would they give you cancer too? If you just smoking straight
Yes.
weed, marijuana in you take the tobacco out the cigar and roll your weed up in, they still give you the cancer too?
That I'm not sure, but still, you're going to roll it in tobacco leaf, right? And these things, they don't burn very well, and all these combustion products that you smoke, when you roll it and smoke it, and there are some carcinogens in that too. And if you do it a lot, definitely, I think it can affect your health for sure. And even marijuana use, if you do it routinely, the thing is, it has shown to cause early onset dementia and other issues with your brain. So I wouldn't really recommend doing anything like that. All right.
Okay. Thank you for calling, James. And I think it is just to wrap up, we're talking about being
All right.
hereditary and have it running in your family. Because I think it is an important thing, especially with heart disease. It
Exactly
seems to really
right.
worry. And some people can really take that literally and say, I'm just bound to have it. And you know as well as I do,
Yeah.
your frame of mind has so much to do with your physical
Absolutely.
aspect too.
So yeah, you don't have to lose hope on all that, because even if you have family history, if you do the other things right, most of the time you wouldn't have any problems. Not most of the time. I personally, I never seen anybody who have a very strict lifestyle, on top of the cholesterol and to maintain the good cholesterol levels and blood pressure, diabetes goals, they would never have any bad outcomes.
Right. It's funny, my mother used
Right.
to be the opposite with it. She would go to the doctor, call me and say, I'm doing fine, so you are too. So she would do the reverse, like, I'm okay, that means you're fine.
Right. Yeah. That too. That don't be overconfident with good genes in your family. Just because your grandmother lived to be 103 years
Right.
doesn't mean you didn't have any heart attacks.
Yeah.
If you don't take care of yourself,
Take
so you
care of
got to do
yourself.
your part. Maybe your grandmother did her part, and that's why she lived to be 103 years.
Okay, okay, we have another caller for you.
Okay.
Billy, what is your question for Dr. Beedupalli?
Yes, I want to ask Doc about the plaque that builds up in the arteries.
Right.
Is there any type of, I heard garlic juice will help clear it up. Is that a known fact or that's some?
No, I don't think
Cliche.
so. I don't think there is any kind of juice and anything that'll clear up the blockage, because if it were, then that would have been like everywhere, because it's pretty rampant, this kind of disease. So I'm not aware of anything that can clear up the blockage. The only things that can clear up the blockage a little bit are the medications which are statins a little bit, and also a strict vegan diet and regular exercise. They might do only a little bit, but not any substantial manner. So for the most part, they are there to stay, but you can stabilize them and not progress any further by maintaining a good lifestyle and taking your medications and controlling your diabetes and high cholesterol levels and keeping up with your doctor's appointments. All these things go a long way in stabilizing those blockages, and may in fact regress a little bit, if not a lot. But I don't believe any juice, anything like that can do that.
Does that answer your question?
Yes, ma'am. That sure did. But now I know that's not just a cliche. Thank you, Doc.
All right,
Appreciate
you're
it.
welcome.
Mm-hmm.
Thank you for calling. And so we've mentioned a vegan lifestyle a couple of times. Oh, we have a Betty on the line. Betty, what is your question?
Okay, my lower leg around my ankle turn darkish color. Does that have something to do with the blood flow to my legs and feet?
It's hard to say. It could be, but it can be so many other things, like even eczema or dry skin can cause that, or sometimes so there's so many other different conditions that can cause dark pigmentation of the legs around the ankle. But definitely this is something to consider. If you have any, especially if you have any pain in the leg when you walk, or even when you're at rest, if there's like a lot of pain in the leg, that could signify decreased blood flow, but it might not be. Also, it's hard to say just by the fact that there's black discoloration around the ankle. It might be something very benign. So you might want to talk to your doctor and let him examine and see what exactly is going on in that area. But yeah, that does not necessarily mean lack of blood flow, but it's possible, but it's not necessarily. It's definitely hard to say.
Okay, I thought I may have a blockage in my leg area.
Yeah, as I said, you may want to talk to your doctor and let him or her examine that part of the leg and see what exactly is going on. But yeah, I wouldn't be alarmed about the blockage right now, but because of the fact that it is black color discoloration. But it very well could be. Don't ignore it.
Okay, but when I get up in the morning, I wake up through the night and around my legs and feet and that like burning sensation.
Okay.
Would that have anything to
Again, yes.
do with the blood?
It could be if you have, especially in the morning, if you have like burning sensation and pain in the leg, it could very well be related to lack of blood flow, or it could be what you call neuropathy. It could be because of the nerves. If you have diabetes, that can cause some neuropathy, that can cause these kind of problems too. Again, as I said, all of these could be a sign of decreased blood flow to the legs. At the same time, it can be something else, like, as I said, neuropathy also, or sometimes it can be the back problems. The sciatic pains can be going down there. I don't know if that's related to that. So it definitely need to be addressed. So talk to your doctor and then let them do the further workup to see what exactly is going on. But I would say do not neglect these things, but definitely get some attention and get some workup.
Okay, doctor. Thank you so much.
You're welcome, ma'am. Take care.
Thank you so much for calling. We have a Danielle on the line for you
Okay.
now. Danielle, what is your question for the doctor?
Hi. Yeah, it's kind of a weird question, but
Sure.
there was a doctor on a few weeks ago,
Okay.
and he was talking about a certain arthritis. I think it was ankylosing spondylitis,
Okay.
and it could affect the heart as well. I
Yes.
was wondering if maybe you knew anything about that.
Yeah, the ankylosing spondylitis can affect the heart. It's mostly it affects the aorta. The aorta is the main blood vessel that comes off the heart and supplies the blood to rest of the body. That's the main conduit that supplies blood from the heart to the rest of the body. And right at the place where this aorta comes off the heart, there's a valve called the aortic valve, and the ankylosing spondylitis can affect this area of the aorta. It can dilate and cause some leaking of that valve, and sometimes if this aorta gets too big, you might need to be even surgically replaced. But somebody need to be following up on that. If somebody has ankylosing spondylitis, you definitely have to consult your primary care doctor to see if you need an echocardiogram. That's an ultrasound of the heart that can see how big your aortic root, that's what we call it, the aortic root, how big that is, because you need to keep a check and see if it is dilating too big to the point where it needs to be operated on. But definitely, yeah, ankylosing spondylitis can affect this aortic root, and that's the only thing that can affect the heart as far as I know.
Okay, I was just my father has ankylosing spondylitis, and he's got some cardiac issues, and they haven't been able to pinpoint anything down, and he's thinking that it may be the ankylosing spondylitis that is causing his heart issues. Thank you for clearing that up.
Okay, you're welcome, ma'am. I hope I answered your question.
You did. Thank you so much.
All right.
Yes, thank you, and good luck to your father too. Thank you for
Good luck.
calling. And we talk about that too. Sometimes we think we have one thing, but there are other overlapping things, not just something causes something else, but you can have this and then develop something else. Sometimes
Right.
it's related, sometimes it's not. Is that correct?
Yeah, right. The heart is affected by so many different things. Atherosclerosis is one thing, but there's so many other, even infections sitting in your body can go seed your heart valves and make things really miserable and life-threatening. And anything in the body, can affect the heart, in fact, and then they can have consequences from that.
Right. And how is
Right.
it diagnosed? How do you know specifically that this is what's going on?
You're talking about any specific condition,
Or this, like atherosclerosis? How do you know?
Yeah, atherosclerosis, the way to diagnose is somebody is having chest pains. We need to know if that is coming from the heart, from the blockages, or no. We can do different stuff like, we can do a stress test. We can put them on a treadmill and see, when they walk, then the heart rate goes up, and if there is a blockage, then they'll start having chest pains, and you can see some EKG changes. We can take some pictures of the heart to see if there is any blockage there at that time. More recently, we're doing CAT scans. We call that coronary CT angiogram, and then with the CAT scan we can clearly see where exactly the blockage is and how bad the blockage is. Those are all non-invasive ways to diagnose the blockages, and we can even the blockages in the neck arteries that go to the brain, we can do ultrasound of the neck arteries and see how bad they're blocked, and maybe even the CAT scans and CAT scan of your leg arteries to see what kind of blockages you have. And the more invasive options would be what you call a heart cath, coronary angiogram. These days we can go through the wrist or through the groin. We'll put a catheter in the heart arteries, put some dye in there, take pictures, and see how bad the blockages are. And if you do see blockages that we think needs stent, we can do the stent at the same time. And same way with the legs also. If you have blockages here, if you think we need to take care of it, we can do stents and improve the blood flow. For say, like if somebody has like wounds on their legs that are not healing because of lack of blood flow, you can improve the blood flow by opening them up. We can clean them out, squish the blockage to the side so that we can have good blood flow down the leg. And same thing even with the brain, we can just put stents here too to improve the blood flow.
So much you can do to
Yeah,
pinpoint,
so
find
much you can
out,
do,
and other
yes.
treatments. It's so good to know that there's several things we can do.
Right.
Biggest thing is prevent it.
Exactly.
Healthy
Prevention is better
lifestyle. And once again, with all of our callers too, if there is something you're ever alarmed, just go to your doctor and
Exactly,
ask for
right.
sure. So,
And
yeah.
always prevention is better than cure.
Right.
You know, just have a healthy
Okay.
lifestyle, have time for exercise, eat right, and you'll lead a happy, healthy life.
All right, that's a great advice to end on. Thank you so much for being here, Dr.
All right.
Beedupalli. We appreciate it.
You're welcome, ma'am.
everyone,
It's my pleasure.
We'll
Thank
see you next time on Healthline 3. Our pleasure.
right.
Thank you, everyone.